Hello everyone, my name is Trevor Cox and I am a current dietetic student here at University of New England, and I'm excited to share my food service management report with everyone. I want to first start off my presentation by providing a brief program description. This was completed at McLeod Health Seacoast. This was a 155 patient bed facility, and the goal of their organization is to improve the overall health and well-being of their patients. Key principles of this organization include caring, person-centeredness, quality, and integrity. This is comprised of key stakeholders that includes an ACO, participants, and governing body. An ACO is a collaborative group of healthcare providers, including doctors and hospitals, who work together voluntarily to provide coordinated and high-quality care to patients. McLeod Health Seacoast and Loris prioritize serving vulnerable populations and eliminating barriers to promote a healthier life for all. The Dietary and Food Service Department plays a crucial role in supporting this objective. There are many different hospitals within McLeod Health, including Florence, Darlington, Dillon, Manning, Cheraw, Loris, and Little River, and this is inspired by individuals within the community. Throughout my food service rotation, I completed many different projects. However, the one that I felt most fitting to exemplify is the Food Satisfaction Survey. A food service satisfaction survey is used to understand better how satisfied the customers are with the food service provided and how we can better serve them. The aim of this project was to collect data on aspects of food service experience. The purpose of the project is to assess level of patient satisfaction and quality of service, and the main goal is to identify areas of improvement within the food service department at McLeod Health Seacoast. This is a copy of the questions that were included within the Food Satisfaction Survey questionnaire, and this was completed over 6 weeks during my rotation, but this is a continuous survey completed by the Food Service Department to continually improve upon this process. The questions include, did you receive a menu upon admission? And this is primarily aimed to assess if a patient has received a menu to understand their options for the different meal choices. And also going along with that, has someone explained your diet order to you? Have you received your meals in a time frame that met your expectation? This one is aimed to assess if patients are receiving their food on time or of how we can improve this. Sometimes this is out of our hands, however, we do like to record this if we do need to switch the process with this. And also, did the temperature of your food and beverages meet your expectation? This could go down to control and temperature safety concern, and also to see if we need to improve upon our equipment or to check to see if there are any malfunctions. And also, has the food service team been courteous and accommodating? This goes back to patient satisfaction to make sure that each of our staff and everyone within the hospital is living up to the McLeod Health mission and vision. And also, lastly, we like to ask on a scale of 1 to 5, how would you rate your meal experience? And this incorporates all the questions listed prior to this. Next, I would like to speak on the continuous quality improvement plan that I created for this project. This is sometimes referred to a performance and quality improvement plan, and this is a process of creating an environment in which management and workers strive to create constantly improving quality. The first step is to design the survey, and this is to develop a comprehensive food satisfaction survey questionnaire, incorporating the provided questions and additional relevant ones. Next, we're going to look at data collection, and this is the next step in the process. And this is when we implement the survey across the healthcare facility, ensuring it reaches a representative sample of patients. While we cannot reach every patient within the facility, we try to get a wide variety of patients on different floors and different units to make this a comprehensive. Next, we look at the data analysis, and this is to analyze the survey responses to identify trends and areas of improvement. Next, we move into action planning, and this is to collaborate with food service department to develop strategies to improve on the areas that we have highlighted. Next, we implement the action plan that was previously assessed and decided upon. And lastly, we monitor and evaluate for continuous improvement. Once the continuous quality improvement plan has been created and assessed, we move into the objective section of this presentation. The first objective is to enhance patient satisfaction, and this is to determine the level of patient satisfaction within the food service department's performance and identify areas of improvement. Next, we improve upon the quality of service, and this is to identify specific areas of concern or dissatisfaction raised by patients and develop strategies to address them. Next, we aim to offer better nutritional support, and this could look in the fashion of improving menu offerings, and this is utilizing feedback to make menu alterations that cater to patients' preferences and dietary needs to offer better nutritional support. Lastly, this strengthens the staff and patient relationships by allowing the patients to see that we are listening to their concerns and improving upon this. And this improves staff courtesy and accommodations to create a positive dining experience for patients. Now that we've assessed the objectives of the food satisfaction survey, I have developed a plan for improvement of ways to improve upon this process. First, we want to incorporate real-time feedback, and this improves patient satisfaction. In addition to conducting periodic surveys, consider implementing a system for real-time feedback collection. This can be achieved through many different digital platforms such as tablets or kiosks, where patients can provide immediate feedback after each meal or to their nurse if they are bedside. Next, we look to improve upon engaging staff in the feedback process to ensure that we are having staff meetings and collaboration so that they understand what the areas of improvement are. Next, we look at diversifying data collection methods, looking beyond just a food satisfaction survey, but at what are some other ways that we can also assess this to really understand the needs of the patient. Next, looking at a shorter survey implementation cycle. As previously stated, this was completed over a 6-week period, and this is a continuous survey. So an area of improvement would be to do shorter survey lengths and to alter the questions depending on what the area of improvement is, and to offer staff collaboration with this, and to look at areas for growth and continuous quality improvement, and lastly to address areas of need and potential barriers. After all of the areas have been assessed and reviewed within this presentation, I would like to provide the audience with a conclusion. So, originally stated, the purpose of the food satisfaction survey is to collect data from the survey, and next is to utilize the data to improve service quality and patient outcomes. And lastly is to incorporate key strategies to improve food service operations, as noted within the objective section and also the area of improvement section. I want to thank you for your time and listening to my presentation. I hope that you were able to gain knowledge within this area of food service management and also to learn more about the purpose and utilization of a food satisfaction survey. Thank you.